Hi, it's Dr. Lewis Clark, and just when you really needed more COVID-19 information, here I am. Well, actually, this is going to be a little bit different, so stay with me. Because if you really wanted to get COVID-19, what are the top 3 things that you should do? And I've thought about this, looked at the research, and I think it's very easily to get any kind of infection if you do these 3 things. So number 1 is stress out. Wow, how about that? Did you know stress decreases your immune system, causes you to be more likely to get any type of illness, or especially a virus? So guess what? Get off the news, okay? Because all you're hearing is all the worst case scenarios. That's all we've heard from the beginning. And so far, everyone has been wrong, and they've overestimated the death rate and everything else. So in order to stop stressing out, you're going to have to get real numbers and focus on some positive things and quit looking so much at all the negative things going on. Number 2, if you really want to get COVID or anything else, what you should do is sugar. And not just a little, but get a lot of sugar in your diet, okay? And sugar also decreases your white blood cell function, causes it to be more sluggish. It can't handle as many viruses or bacteria or anything else that's going on inside the body. And number 3 is decrease your sleep. Sleep deprivation is also very detrimental to your immune system. When you sleep, actually the hormones that elevate in sleep help your immune system to function normally. So be sure, if you don't want to get sick, that you don't do these top 3 things, all right? And I want to share with you also, while we're on this video, some other information to help you in particular to deal with this one, the stress factor, which by far is the biggest thing that people are having to deal with today. I had a patient ask me this morning, could you please educate me so that I wouldn't be so fearful? Well, let me tell you what I told her. Number 1 is that in a perfect environment where the virus has all the advantages, like for example on the cruise ship at the beginning of this COVID-19 problem, and the aircraft carrier where we had 3,000 in one and 4,000 in another, confined in a closed-in, tight area where the virus was running rampant, and that was for weeks. Guess what? Less than 20% of the people got sick. So that means basically 80% of the people probably won't or can't get it. That's good news. The other thing is studies have shown that 90% of the people that do get COVID have comorbidity, meaning they have some other type of health illness. So if you're one of those people, then you need to take more precautions, obviously, okay? If you're not, well then realize that your risk is lower and you can live your life and do your things, take the proper steps, but go ahead on with your life. And what I mean by comorbidity is they have another illness, another underlying chronic illness like diabetes, hypertension, heart disease, cancer. And let me share this, by the way, too. Almost 50% of the people in the county where we practice at, in Montgomery County, this was at last week's numbers, there was 43 deaths in Montgomery County. Out of those, 20 of those were in people 80 years old or above. So guess what? There's another risk. You have to, elderly obviously are at a greater risk. Anybody with a compromised respiratory system as well. But good news is, if you're not in that category, then you're probably doing pretty well. And lastly, I want to share this. What's one thing you can do? And one thing that hasn't been talked about nearly enough. And we've talked about vitamin C, we've talked about zinc. Those are very important. There's some other things like olive leaf extract, which I'll tell you right now, that and monolaurin, which are natural compounds that can actually prevent the replication of the virus. It can't reproduce, and it also prevents it from being able to attach to the human cell. So that's great news. But here's the one I want to share today, and this is vitamin D. Based on a British Medical Journal study of 10 different countries, they found, and it's over 9,000 patients that they studied, they found that the people with almost none of the people that died had anywhere near normal vitamin D levels. Okay, so vitamin D helps regulate your immune system. So one, it gives you a more effective immune response, so you're less likely to get it. But then if you do get it, it also it causes you to be able to regulate the immune response, so you don't have that cytokine surge or cytokine storm that they talked about that can be dangerous for some people. So if you're not taking vitamin D, man, I recommend you crank it up about 10,000 IUs per day, and that'll help you not only prevent it, but then also, if you do get sick, it'll help you control it and limit it. So, hope this helps. Number one thing, remember, don't stress out. Watch your diet. Make sure you're getting enough sleep. And then you'll be able to be like me and live life well. And until next time, God bless. Have a great day.